So welcome, Clear Vision Wednesday tribe. I'm Claudia Mühlenweg, the National Vision Improvement Teacher and creator of the Naturally Clear Vision Method. And before we dive in, make sure to subscribe to this channel if you find this video either live or as a replay. And today we have a topic that people are very interested in. Also, it matches the Halloween theme. So here's my little ring that I found on the beach, and here are my little balls, you know, the little red eyes. We think they're cute for Halloween, but nobody really wants these red veins in their eyes. And I have a special guest today, and I'm going to bring him on. It's my dear friend, holistic eye doctor, Dr. Marc Grossman. He wrote the book Natural Eye Care, and he has a lot of other books. So welcome to the show, Marc.
Thank you, Claudia. Great to see you again.
Yeah, great to see you. So we're not going to go through your whole bio. I will put that in the show notes, and any links I will put in the show notes. So let's talk a little bit about red eyes, which is similar but not the same as dry eyes. So can you give us a little bit of an idea, like what are the causes of those little red the veins in the sclera and the white of the eye?
Well, it's interesting. Red eyes are always an indication of something, okay? It could be environmental, it could be allergies, it could be dry eyes, it could be a wood stove, like I said, because of the air, it could be dehydration, and it could also be a broken blood vessel. The broken blood vessel one is the one that scares most people, but it's not really dangerous, and it's called a subconjunctival hemorrhage. Sounds much worse than it is.
Yeah.
All it means is that there's a little broken blood vessel in the eye, and then in a certain quadrant, or just to the left or down, or half the eye, it's like all bloody, and people get scared, and they send me the picture. Should I go to the emergency room? Da, 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 da. But if anybody looks up subconjunctival hemorrhage online, they'll see a picture of it. And we also have a whole thing about that on our website, naturaleyecare.com, which we'll talk about later. So that's the scariest one. That looks the scariest. The other one that could be a scary, dangerous one is if you have a thing called narrow angle glaucoma attack. All of a sudden, the pressure in your eye goes up to, let's say, 30 or 40, and you get this headache. Usually the red eye will come in conjunction with a headache. In that case, you need to immediately go to your ophthalmologist. Don't even bother going to the ER, because the ER is just going to call in the consulting ophthalmologist. Find an ophthalmologist or an optometrist who can prescribe medicine to get that pressure down. There are also specific tests that the doctor can do during your eye exam that can see if you do have a tendency towards a narrow angle. So when you go to get your eyes examined, ask them, did you check to see how my angles are in my eyes, the angle between the cornea and the iris? So some people have an anatomical vulnerability to the possibility of narrow angle, but it's not very common that you'll have an attack. I don't mean to scare anybody, but most of the time red eyes are due to allergies, dry eyes, you get something in your eye. Yeah, those are the more common, over 90% reasons for dry eye. But I did want people to know that a red eye can be a possible emergency in a narrow angle attack. And remember, again,
especially if it's only one eye, right? You said if it's only one eye, that's
and usually that would be one eye. It would be very rare that it would happen both eyes at a time, but who knows if you have got narrow angles in both eyes. But the thing is that'll usually become associated with a headache right in the eye at the same time. So that's how you differential diagnosis that. So
what are other causes? Like, you know, I noticed that my right eye has more like red veins, but it always for a long time than my left. But what are other causes of that? I would think alcohol abuse could be a cause. Are there any other things like liver detoxification problems or?
Yes, in Chinese medicine, those of you who don't know me, I've been an eye doctor for 42 years and an acupuncturist for 34 years. So the eye is a reflection of the whole body. So the liver is the main meridian that relates to the eyes. So doing liver cleanses, checking to see if you're taking medications, which all have to be detoxified through the liver. Sometimes, many times, even those glaucoma drops that we prescribe for glaucoma will cause red eyes. So we want to look at, is there any side effects of any of the medications that can cause red eyes? Do we have an imbalance in our liver? The white part of our eyes towards the outside are actually relate to the lung meridian. So the lung meridian, are we having things in the lung meridian? So Chinese medicine and red eyes are related, but the primary one would be usually the liver meridian.
Okay. And are there any other, you talked a little bit about wood burning stoves, so it could be dust, it could be smoke, it could be allergens, air pollution. What about sunlight? Because I get that question, there's something, I know that's a different thing, but surfer eye, where your eyes get really yellow. So it could be an excessive amount of sunlight also create those red veins in the eye.
Right. What happens with sunlight is that the ultraviolet light breaks down the morphology of the tissue in around the eyes. So two things occur. One, you get a little bit of red eyes, but also a development of a thing called either a pterygium or a pingueculum, which is sort of like a yellowing on the white part of the eye that sometimes comes in with it some redness too. Those are very much more common with people who live near the equator. So because they live near where it's sunny, the intensity of the sun, Florida, Southern California, Puerto Rico, equator-like things. So pterygiums, pingueculums, and the red eyes are associated with the excessive sunlight, with the ultraviolet light breaking down the tissue.
But that's, we obviously both propose natural sunlight exposure as a really important piece of natural vision improvement. So this is talking about excessive near the equator. I knew one friend here, lived here in Los Angeles, who was at the beach every day, and she never wore sunglasses, but she was literally on the ocean every single day. So that might have been too extreme. That was the only person I've ever seen with that little bit of a yellowish tint. Anyway, so let's switch a little bit from what other things can cause it, like certain conditions. I think you talked about allergies or, pink eye, that's a little different, but any other things that could be kind of causing that or be, a reason to see the eye doctor other than that narrow angle glaucoma you talked about?
Oh, yeah. Well, conjunctivitis, either viral or bacterial. I mean, it could be from a virus. It could be from a bacteria. It could be an infection. And you do need to treat that with antibiotics or certain viral medications. Now, we're going to be talking about some natural antibiotics, natural herbs to work similarly. So you can do those also in conjunction with the medications or sometimes separately instead of having to go directly to the drugs. But yes, red eyes can be, especially if it comes with itching. Okay, if it comes itching, it's more allergic conjunctivitis. So there's allergic conjunctivitis, bacterial conjunctivitis, viral conjunctivitis. Those are things that need to be diagnosed by the eye doctor. The other things is that you could have contact lenses. If there's not enough oxygen coming to the eye, your eyes may get red due to an ill-fitting contact lens. And of course, one of the primary reasons is the eyes tend to get dry, and that could cause red eyes also. And excessive computer work, which I'm sure you're going to talk about, because when people are on the computer, they tend to not blink as much, they tend to not breathe as much. So being on the computer all day long, and the person goes, oh my God, I got red eyes now. So incorporating the Bates work of blinking and breathing, and very, very important, and palming, very, very important in visual hygiene to reduce the risk of red eyes. So
yeah, let's talk about we have top 10 remedies. You already mentioned two of them that I wanted to talk about. That's totally okay. We do it freestyle here. But yes, blinking is one of those simple things that keep your eyes lubricated, and doing a lot of it almost every second. As at screens, studies have shown that we blink less when we look at screens compared to looking into somebody's eyes. we naturally blink more because of that social contact versus the screen. So that's a good habit to have. Palming is what we do when we close our eyes and we cover them. You can rub your hands together and you cover your closed eyes with your hands like so. Relax your shoulders. We're not going to go into how to do this, but the key is that you want to relax your mind and that you want to kind of enjoy that darkness. And that really helps lubricate the eyes. And I've had many people with that were on eye drops, not for glaucoma, but on the dry eye drops that were actually able to eventually phase those out by just doing more blinking and more palming. So what are some other things that you recommend so assuming that you don't have a serious condition behind this, right? It's just like those red eyes, is maybe from dry eyes or maybe from dust or smoke or one of those things, but you don't have an infection or glaucoma or one of these serious conditions. What are some other natural remedies? And you said even if you have one of those serious conditions, it could be in addition to maybe some antibiotics or whatever drugs you have to prescribe. What some other natural remedies that you could add to the two that we mentioned so far?
Well, you talked about a very interesting point there, because when you're on the computer and you're doing those things, one of the things that can cause dry eyes is eye strain, that you're straining your eyes, and the Bates method is all about reducing the eye strain. And of course, if you're doing the blinking or the palming, remember to breathe, because the eyes need oxygen. So I call it I call it the 4 B's: breathing, blinking, beaming, smile. If you smile, you can't strain your eyes. It relaxes the muscles. So you want to remember to breathe.
What's the fourth one? What's the fourth one?
I know there's a 4th B. Blinking, breathing, I have to remember it. I know I increased it from 3 B's to 4 B's. Blinking, breathing, beaming, and I think I have to think of it as a B, but it's almost like, not staring, because staring can cause dry eyes too, because you don't get a blink and breathe enough. So I think it's like brushing. Brushing.
So you mean like brushing the environment, like moving your eyes around?
Right. Brushing, blinking, beaming, and blinking, the 4 B's for visual hygiene. Now, you asked me a question about herbal remedies, natural herbal remedies for red eyes. So there was a doctor, herbalist, many, many years ago, probably about 80 to 100 years ago. His name was Dr. Christopher out of Utah. And Dr. Christopher put together a whole bunch of herbs together for formula for red eyes, conjunctivitis. I tweaked his formula, and I use about 90% of his formula in a formula that I have on my website called Eyes. We'll put it we'll get you the link to that product. But basically, which herbs are the most important in that? The herb I took out of his formula was cayenne, because cayenne is very hot. So I didn't want to take that chance. But the good herbs for helping with red eyes are eye bright, which is a great herb. Chamomile, really good to do, like chamomile or even just chamomile tea bags around your eyes. Calendula is in that formula. Echinacea and golden seal, which are natural antibiotics. Florentia, which is a natural antibiotic. But I would say the main ones in there are those eye bright, the chamomile, and the echinacea, and the golden seal, and calendula. So those are the main ones to help with red eyes herbally. And again, when I do it as a tincture, I put in a dropper full of the herbs into the tincture, boil 8 ounces of water with the tincture at the same time, let it boil for at least 3 minutes, boiling together to burn off the alcohol content. And then you put in a clean compress, like a washcloth, and put it over your eyes, even if your eyes are closed. So those are my main herbal things I recommend.
Awesome. And so there's so many interesting aspects. So, but you also mentioned tea bags. So in a pinch, you can also get chamomile tea bags and just make sure they're not hot, but you can put them on your eyes to help with the closed eyes. What about, we talked, first of all, we want to mention hydration. So lots of clean filtered water. I think a lot of us are dehydrated. I definitely, in the summer when I'm sweating, it's easy to drink a lot of water, but when it gets colder now that we're heading into winter, sometimes it's harder to drink enough water. And I sometimes like to warm it up a little bit so it's my body temperature, which makes it easier in the winter. But we also talked about hot and cold compresses, what I also recommend. So tell us a little bit, if you have that red eye, would you do hot or cold both together, or what would you do first?
Very good question. If it's an itis, if there's itching, if I think that it might be secondary to an allergy, I'll do a cold compress. Anywhere from a cold compress to like a chilled spoon that I could put on my eye, to you'll talk about this maybe a little bit more, like a cool cucumber, something that just brings down the inflammation, because there's a heat going up. And some people are more, in Chinese medicine, have more of a response to heat rising, as we say. So the red eye, we want to do the cool compress. Now, if it's a warm compress, the reason it's like, oh my God, how can warm compresses help red eyes? Because if it's due to dry eyes with the meibomian glands being backed up, and we want to open up those glands to get a better tear film, then we'll use a warm compress instead of a cold compress. And sometimes, just for general visual hygiene, we will do alternate warm, cold, and depending on the person's constitution, I'll see and what's going on, I'll either tell them to end with cold or end with warm. So the first rule in many of the things that I do is that there's no rules. You don't, even with red eyes or anything, and we know this as Bates practitioners, you don't treat the eyes, you treat the person behind the eyes. So that's why it's, we're going to give you these tips and ideas that you could use, but, and none of these can hurt you, but I'm just saying, we got to treat you, not the eyes.
That's a really, really great point that you brought up there. So like, why is this red eye showing up? And I love that you said there's no rules, because it depends on so many other factors. Yet at the same time, our purpose today is to give you some remedies that you could try out. And obviously after you've cleared up with your eye doctor. But yes, so let's talk about, because you mentioned itching. And sometimes something I hear all the time, and that I used to do, like I was really good at like rubbing my eyes really hard, and it actually feels good, right? Most people like rubbing the eyes feels good. But then I had shown an MRI scan of how it looks like, and we now know that keratoconus, astigmatism, especially if you keep rubbing the same direction, and can really, it's really not a good idea to rub your eyes. So what can people do instead? I sometimes recommend the cucumber slices, or sometimes I just kind of massage around the eyes a little bit, right? I'm not actually rubbing, but other things that people can do, obviously clearing up that the infection isn't, the itching isn't an infection, and but we all have this itch sometimes, where it's just like a little itch, but it's not actually an infection. Any other tips you could do instead of the rubbing?
Yeah, a lot of times the rubbing or the itching comes from a condition called blepharitis, which could also lead to red eyes too. Blepharitis is inflammation of the eyelids. So again, as we go to the dentist and they talk about dental hygiene, floss, use a water pick, do oil pulling, whatever, we need to talk about visual hygiene for the lids. And visual hygiene for the lids, besides that eye ease herbal compress, there's also a eye drop we have on our website, where you can get online, called MSM. MSM is an anti-inflammatory. And then there's different eye drops. We'll put in the links to them later, that have what we call hyaluronic acid in it. Hyaluronic acid, there's 2 eye drops that I usually recommend. One is called Optase, and one is called Hylatears. And then That's, they again have a little hyaluronic acid in it as an anti-inflammatory. Then you could do a lid wipe with tea tree oil and hyaluronic acid in it also. That's available. And then a scrub, I know I'm giving an overwhelming information, but a scrub that has 1% hypochlorous acid in it to kill any bacteria that might be in it. So once you clear your lids and make your lids, eyelids and meibomian glands working functionally, you might only have to do lid hygiene once or twice a week to keep it good. But sometimes you might have these little bit, like you wake up in the morning and there's a little bit of crustiness there.
Is that not normal? Is that not, because I always have, I mean, if anything, I have it here in the inside, like we call it actually sleep in German. We call it like, it's just, is that something that's not normal to have a little bit of that? Like is that?
I mean, most people have it, but it's because the eyes tend to get a little drier at night, backs up the gland. So that's why people go, they get up in the morning and they put a warm compress on and then bingo, they're back in business because it just wipes away all the things. But it doesn't mean you have to do all the things that I just said to you about. I mean, all those things are available and we have them, but it's like just a warm compress in the morning might just take that little crustiness away. And you mentioned a very important point. Hydrate, hydrate, hydrate. We are 80 to 90% water. And the amount that you should hydrate is almost like 4 ounces every half hour. So the optimal to hydrate is usually half your body weight. So if you're 120 pounds, do 60 ounces. But I'm just saying, but a little bit at a time so you don't overwhelm your kidneys.
That's a great point, because sometimes I'm like, oh, I try to drink 2 of these 40-ounce bottles. That's a little bit more than half my body weight, but sometimes I'm like, by like 11 a.m. I have 2 of the bottles down because I was sweating or exercising, and other days I'm like, oh my God, it's already 3 p.m. and I don't even have the first one finished. So that's a good point to make sure that you kind of space it out. And we have a question on the YouTube, and I just want to address that right now. Wanda says, golden seal and echinacea are both drying. Can that be a problem for certain people?
Well, yeah, I mean, if you were taking it internally, it could be, but remember I said the herbal compress that I have, it has all the herbs in it, has about 10 to 12 different herbs in there in the IE's herbal formula. So the echinacea and the golden seal are just a little part of it. It's not like you're doing that direct. I wouldn't just do the echinacea or the golden seal alone. I mean, the thing about Chinese medicine and herbal formulas is that they have to be balanced. So that's when you balance it, it may not have that side effect.
Great point. I have before I ask my question, there's one in the Zoom chat here. Can we discuss red skin around the eyes? So if you have a lot of redness around the eyes, what could that mean?
Well, there's a condition called ocular rosacea. And that it's a tough one. Yeah, I've worked with that with people, anywhere from doing acupuncture on them to herbal things, because then when you're talking about when it's in the skin, when it's in the dermis, in fact, embryologically, the skin and the eyes come from the same place, the skin, the eyes, and the retina. So you got to be, that means that there's a lot of heat in the system. So yeah, ocular rosacea sometimes we'll use different creams. I'll, work with them herbally, different diets that are, totally an anti-inflammatory diet. I might, depending on their constitution, I might do more of a keto, modified keto diet, because I don't, the glucose and sugar levels can cause more inflammation. But yeah, things around the skin, but the condition is called ocular rosacea. Okay,
good. So I would assume if it's inflammatory, that the cooling things that we talked about can also help, the cucumbers. Okay. I have a question. So I hear a lot about, and I've done this myself, castor oil. So I've never put it in my eyes, but I put it on my eyelashes. And so like a lot of it at night. So could that be a helpful thing to pull out some other things, castor oil?
Yes, yes. I've actually used castor oil eye drops in the past for people. It's an anti-inflammatory. I use castor oil all the time. Not only is it great for your eyes, it's great for your skin. When I go in the sauna, I put castor oil
Oh,
on,
really?
put
Okay.
it on the balls of my feet. I put it on my liver below the right breast to do a detox. Remember, castor oil was probably Edgar Casey, who was a medical intuitive's #1 remedy for almost many things because it was so helpful. So castor oil is like palms of Christ. I mean, it has not only a medicinal ability, it also has an energetic helpfulness to it also. So yeah, I'm biggie on castor oil. It's not going to hurt you.
Great. So I don't see any more questions here on YouTube or in the Zoom chat. Anything, I think we can come to a close. We just wanted to make this a sweet, short little tips for red eyes, just because it matches Halloween. And, you know, we always like, so, you know, when I looked at my photos originally from my eyes, when I first did my teacher training, I noticed that my right eye had a little bit more red spaces, but the left eye had barely any. And of course, then you go in Photoshop and you remove them because they don't look that attractive. But so this was super helpful. Thank you so much. Any closing words you want to add to YouTube? I don't see any more questions. Anything you want to add?
Sure, a few things. One is, you know, people might think, well, why does one eye get more redder than the other eye? It could be to those dryness in the meibomian glands, that one eye is drier than the other. It could be internally that, remember we talked about hydration, that the adrenals, the kidneys, that one adrenal is working better than the other adrenal. So your Chinese medicine practitioner can look at that. But red eyes, you know, if your eyes persist to be red, please go to your eye doctor, because it might be an infection. It might be, you know, clear that out to no matter what, but these natural remedies are really helpful. My website, naturalecare.com, has hundreds of pages on why this, you know, natural ways of working, and both Western and medical studies on all these things. And I hope the information that I gave you could be helpful in helping you deal with red eyes if you ever have them. But
thank you so much. I mean, your website is just a chock full of information. I also have the big book. It's a really thick book, Natural Eye Care, that you can get, that has literally all the science, all the studies. And I love that you have the holistic Eastern approaches and the holistic ones, the Bates method and the traditional treatment, so that you, and also the nutrition advice, what nutrients you need. So that book is really amazing to get, and we can put a link in the YouTube description for the book. I do have like one last thing I just popped into my head. So why do we call these overnight flights red eyes? You know how we call them red eye flights? Do you have a
because that's a beautiful way to sort of end the discussion. What happens to a lot of people on flights? Two things. One is they don't sleep. And when you don't sleep, a lot of times your eyes are red in the morning. Right? Because your whole body doesn't get nourished. Two, you dehydrate, right? And three, the oxygen, the air isn't very good. So you're almost, it's like almost a perfect storm that if you take a long flight, you might wake up with you might get back with red eyes because you didn't, and the red eyes, they call it when you go overnight, like from California to New York. So you haven't slept, you haven't drank a lot of water because you don't want to keep going to the bathroom at night.
Exactly.
Because you're on a flight, so you're dehydrating because you're not sleeping, and the air isn't good. So it's a perfect storm for red eyes. Now that's my explanation.
That makes total sense to me. I love that it's a trifecta, and most people might also drink alcohol to fall asleep. So it's kind of, yeah. Well, thank you so much. That was awesome. So we're going to have a little bit extra time in the Clear Vision Club here on Zoom. Thank you, YouTube. And by the way, the whole month of November will be all about liver and gallbladder flushes and cleansing and the connections to the eyes. And Dr. Grossman is going to come back and do more education on that whole connection of the liver and gallbladder, because that detoxification pathway is so important for our eye health, especially as we get older. All the bad stuff that we did over the years is catching up with us. And so maintenance is even more important. All right. Thank you, Dr. Marc. Good to see you, and bye, YouTube.